Well, good evening and welcome to the COVID-19 pandemic update. I am Kayode Okikulu. First, the highlights. Will Nigeria introduce stricter measures to keep the India COVID-19 variant at bay? Well, all eyes on the government as some experts deliberate on what to do next. And as the WHO commemorates World Immunization Week, the organization embarks on COVID-19 awareness in Yobe State as health workers go from house to house, engaging residents on the deadly pandemic. And the European Union sues AstraZeneca for delayed delivery of COVID-19 vaccine. Well, Nigeria's zero COVID-19 fatality streak has been broken after 12 days. One death was recorded yesterday at a time when the daily cases seemed to be slowing down. New infections totaled 35 across the country, with Lagos topping the list with 18 cases. On the other hand, 3,770 people received their first dose of the COVID-19 vaccine in the past 24 hours as the world commemorates the Immunization Week with a theme, Vaccines Bring Us Closer. The WHO is calling for more investment in providing affordable vaccines for global needs.
Nigeria has continued to record a slowdown of new COVID-19 cases with relatively low figures reported over the weekend. According to the Nigeria Center for Disease Control, NCDC, Nigeria recorded 35 new coronavirus infections in the last 24 hours, a drop from the 51 new infections recorded in the previous 24-hour cycle. The new cases were recorded in 6 states, as Lagos, the epicenter of the disease, had the highest figure, with 18 cases, followed by Rivers with 7 cases, and 6 additional cases reported in Oyo. The FCT registered 2 new cases, while Ekiti and Kaduna states had a record of 1 case each. The agency says the recent figures include data from Oyo State reported in the past 2 days. Till date, Nigeria has now recorded a total of 164,719 confirmed COVID-19 cases. For the first time in about 2 weeks of reporting 0 deaths, the agency has reported 1 death from COVID-19 complications in the last 24 hours. This raises the death toll in the country to 2,062. 239 persons have been discharged after recovering from the infection, including 215 community recoveries in Oyo State, managed in line with guidelines. The total number of recoveries in the country now stands at 154,926. So far, over 1.9 million samples have been tested, while over 7,000 cases are still active. 58.2% of Nigeria's targeted population have received the first dose of the Oxford AstraZeneca vaccine. That's according to the latest update by the National Primary Healthcare Development Agency as at April 25th. Lagos State still takes the lead after vaccinating more than 200,000 people, while Kaduna and Kano have vaccinated more than 60,000 of its target population. Meanwhile, it's the World Immunization Week 2021, global public health campaign to raise awareness and increase rates of immunization against vaccine-preventable diseases. According to the World Health Organization, the theme this year, Vaccines Bring Us Closer, is aimed at building solidarity and trust in vaccination as a public good that saves lives and protects health.
Meanwhile, the federal government says it is keeping an eye on the dire situation in India as the country continues to record over 300,000 daily cases, a global record. Well, there are concerns that if adequate measures are not put in place and enforced, then the Indian variant known as the B1617 might be imported into the country. The Minister of Health, Dr. Osagie Ehanire, is expected to announce measures taken by the government to keep the variant at bay, and if any new tactic will be employed to forestall such dire situation which India has been grappling with. The double mutant variant, as it is called, was first discovered in October last year. It is said to be more contagious than the original virus, spreading rapidly through the country and leaving record fatalities in its wake. The World Health Organization, in partnership with the Yobe State government, has undertaken COVID-19 house-to-house risk communication awareness to over 90,000 residents of the state in its quest to improve sensitization and curb community transmission. The WHO Emergency Manager Health Emergencies Program, represented by Dr. Ibrahim Salisu, a public health officer, disclosed that the aim was to sensitize the larger population of the society who may not have access to information through the mainstream and social media.
The World Health Organization was established to improve people's lives, reduce the burdens of disease, poverty, and to provide access to better health care. In Yobe State, Nigeria, the organization had strengthened the state surveillance system from the nation of 400,000 information education material to capacity building for health workers, training of doctors on COVID-19 clinical management, to supply of assorted drugs and psychosocial support for survivors of COVID-19.
We accept these items donated by the World Health Organization in order to boost our risk communication activities against COVID-19 across the state.
To reach out to larger society, the World Health Organization deployed teams of community health champions to create awareness across the local government councils of the state. The WHO is also providing the necessary technical support for the state government in health system strengthening so as to mitigate the challenges of the pandemic.
We have also deployed teams of community health champions who are working to improve community sensitization in the second wave. In the last 1 month alone, these community health champions have reached more than 90,000 people with COVID-19 prevention messages.
Yobe State, which recorded its COVID-19 index case on April 30th, 2020, now has 390 confirmed cases with 9 deaths across its 17 local government councils as at Sunday, April 25th, 2021.
40,000 persons have so far been inoculated in Rivers State against COVID-19 since the rollout of the vaccine on March the 16th. This is according to the State Commissioner for Health, Professor Prince Will Chike. The figure represents 26.67% of the 150,000 doses of the AstraZeneca vaccine received from the federal government. Professor Chike says the exercise is seamless at the moment, with minimal reports of minor side effects. He also assured that the vaccine is safe. Meanwhile, some community heads in Rivers State are appealing to the federal and state governments to adopt a door-to-door immunization approach to ensure more persons are inoculated.
It has vaccinated 40,000 persons so far. We are still ongoing. We are still doing the same every day. All the local governments are still going on doing the vaccination. Only very few have slightly moderate side effects. Yes. They are just slight fevers, weakness, and body pains. So of course, ordinary analgesics, and of course, some of them were fear, psychological things. So we just had to also cancel them.
I want to advocate that the vaccine should get to the community level in time. Like it used to be for polio and others. It's time for us to go door to door to make sure every Nigerian, gets this vaccine.
Well, for more insight into this, Dr. Donyo Gubanjo joins us on the program. He is a public health practitioner. Good evening, and thank you for joining us on COVID-19 Update. Well, it's World Immunization Week, so let's just get started with that. Incidentally, at a time when Nigeria is pushing for increased COVID-19 vaccination for its citizens. But I just realized I used 2 terms. First, immunization and vaccination. There's a difference, right? Okay, Dr. Gubanjo, if you can hear me, let me just
Sorry, can you
put
take
this
that
through
again?
again.
I had an
good.
interruption. Sorry about that.
It's okay. I was going to ask you, the world is commemorating the World Immunization Week, and Nigeria is pushing for increased vaccination. Clearly, 2 terms there, which are used interchangeably, but there's a difference, right?
Absolutely. Vaccination is just the act of actually introducing a vaccine, into somebody's body, while immunization is the act of or the process, should I say, of actually becoming immune, to a disease, which is a result of vaccination very often. So vaccination achieves immunization often, but not always, which is also why we talk about things like COVID and we say after you get vaccinated, or even yellow fever, it takes a number of days before your immunity reaches the peak where it should be to confer immunity upon you, or where we then achieve immunization. So vaccination is the act to achieve immunization, but immunization is that process or that place where your body is now resistant to disease.
Let me just ask then, for how long do we have to wait till this COVID-19 vaccination becomes COVID-19 immunization?
Well, on average, it takes some 10 to 14 days on the average. And it's expected that you really have the immunization expected to a reasonable degree after you've had a second dose for most of the vaccines we have out there, except for the Johnson & Johnson one, which is one shot. And then it still takes a few days for you to get to a state of being immunized.
Well, the theme for this year's Immunization Week is Vaccines Bring Us Closer. And just listening to some community leaders in Rivers State, for example, they're calling for some sort of door-to-door campaign, basically saying, how about you bring the vaccines closer to the people? Is that something workable with this vaccination drive for COVID-19?
Let me say it's not impossible, because that is something that has been done for other programs. And more recently, that was done for polio vaccination. We had vaccinators who went round the place, door to door. And I'm sure many of us, even though we're not children, we saw them. So it's practicable. It's something that can be done. It's expensive because you have to think about that logistics. That's additional cost. The logistics of these people not sitting in different centers where we go to them, but they have to come to us. So the government will have to provide, transport, provide even meals and whatnot, because they're moving around, so there's additional cost, but it's not impossible to do.
Okay, so let's talk about the India situation. Well, there's a lot of pressure on the government as to how to tackle this, keeping the Indian variant at bay. So how do you think Nigeria should handle this situation? This mutant virus, as they call it, seems to be spreading like wildfire in India. Over 300,000 cases, record global figures over the past few days in India. So for Nigeria, what do you advise government to do?
It's a lot of hard work. It's tricky also. We'll have to, especially because you don't have one access from India to Nigeria. So in which case you could say, all flights from India, we're going to screen them or we block them and all of that. People from India fly indirectly to Nigeria. So it means all flights are suspect. So, but then it also means that the people you will need the most to help out will be the people at the borders, at the ports. And so not even necessarily your virologists or health experts. It's going to be all these other people that are assisting at the ports, the customs, the immigration particularly perhaps. So that process we have put in place for screening people coming to the country has to be watertight, has to function very effectively. And we have to check people. Have they been in India? Are they coming from India? And such people have to be screened even a little bit more, and especially if they are positive, you'll have to check also what kind of virus they have. Is it the variant or something else? So it's a lot more work, and it involves a lot of people. It involves them knowing what this is all about and taking it very seriously.
Well, Dr. Ogumbanjo, on a final note, incidentally, on this day last month, 100,000 doses of COVID-19 vaccines arrived in Nigeria from India, which was a donation from the country's government. So do you think that should play any role in Nigeria's decision here?
Yeah, absolutely not. That sounds a bit like a bribe now, the way you put it. So it definitely shouldn't. We have to do what we have to do. I think nobody, including the Indian government, will blame anyone, for taking any precautions at this point. So we should just do what we think or know best to do.
Well, Dr. Doyin Ogumbanjo, thank you so much for sharing your thoughts with us on the program.
Pleasure. Thank you for having me.
We'll go on a break, and when we return, the EU has sued AstraZeneca. More details in a moment. Join us again. Back outside Nigeria, South Sudan's health ministry has rejected the advice from the World Health Organization not to destroy the expired Oxford AstraZeneca COVID vaccine. The country's COVID-19 incident manager, Richard Laku, has said that the government will not use the 60,000 vaccines and will destroy them. The WHO has asked governments to wait for its guidance, noting that vaccines could be used up to 36 months after manufacture. Dr. Laku said the position of the government is that these doses of vaccines will not be used, but there is an option to destroy them. Similarly, Malawi has said it will also go ahead and destroy more than 16,000 doses of expired Oxford AstraZeneca vaccines. In early March, Malawi received 360,000 doses of the Oxford AstraZeneca vaccines, but found out that the vaccines were due to expire before they were all administered. Malawi's Ministry of Health spokesperson Joshua Malango says the country will go ahead and destroy 16,440 doses of the vaccines because news of extension of shelf life was shared with Malawi after the vaccines had already expired and taken out of the so-called cold chain system, which ensures that the temperature of the vaccine does not fluctuate and then lose its potency. Well, Dr. Deji Olale is standing by. He's a specialist registrar in intensive care medicine in the United Kingdom. Well, thank you for joining us on the program. I bet you're also keeping your eyes on the Indian variant and the situation there. But let me ask you, how close a threat to the UK and the European continent is this?
Thank you. Good afternoon, and I hope you're well back home in Nigeria. I do think that the greatest threat actually is whatever is going on in India. Is the possibility of that becoming another wave of disease in Europe and United Kingdom as well. And underlying that is the concern that our existing efforts at vaccination may be insufficient if this Indian strain proves to be less responsive to the vaccine. However, there's no evidence that suggests that the vaccines will not protect against the Indian strain at the moment. Also, I think another concern is the possibility that the teeming population in India is the right mix, is the right incubator for this virus to develop and mutate into another super strain that may be challenging for us to maintain or to react to in the future. I think by and by those are the main threats that we can come up with regarding the situation in India.
You know, one of the major challenges India is facing is lack of oxygen, and that's for a country that is seen as a reference point in healthcare. I know the UK had gone through their peak moment as well, and you know, some way, just how did the UK handle this?
To begin with, I think the idea that India is a reference point to healthcare, yeah, probably from the Nigerian perspective. Otherwise, when you compare the infrastructure available in the UK to India, for instance, when you look at critical care beds per 100,000, the UK has about 7.5 for every 100,000 people. India has 2.3. So maybe they're not a reference point in that regard. The oxygen challenge, I think it's a question of how resilient your infrastructure is, your oxygen delivery infrastructure, that is locally. In April last year, the same thing happened in one of the hospitals in North London. And at that point, they literally said people should stop showing up at the A&E. So it could happen anywhere. But I think there's no doubt that India's infrastructure is slightly not this, well, maybe more than you will expect, is not the same as elsewhere. In particular, hospitals in the UK tend to have their own local oxygen plants that pipe oxygen to all the wards and where else is needed. However, you find that in India, they're having to actually use large cylinders supplying oxygen at the point of need directly to the patient in a lot of the hospitals we've seen, as reported in the media. So I think that's probably the main distinction in the approach to oxygen delivery to patients here.
So the EU has sued AstraZeneca, and I know that's something that concerns the UK largely, and this is over breach of COVID-19 vaccine supply. Now, the EU is saying that AstraZeneca may be showing what it calls preferential treatment to the UK. Do you see this causing a vaccine war of some sorts?
Well, I think there is definitely some politics going on behind all the vaccinations. Vaccination supplies from whether it's Pfizer or AstraZeneca. AstraZeneca, as we all know, the AstraZeneca vaccine was developed in partnership with the Oxford University. And I think, if you ask me, I think things have moved on a bit from that. I think the more relevant issue with the AstraZeneca vaccine is the fact that more people are seemingly refusing it elsewhere in the world, in particular. I do not see that it will be a major issue between the UK and Europe going forward. Other companies are coming in, Johnson & Johnson, for instance. Many other suppliers are coming up with new vaccines that if there will be any shortfalls, if there will be any major issues from AstraZeneca's UK and the rest of Europe's challenges, that those will mitigate against.
Well, Dr. Lale, as we wind down, you mentioned a challenge. There are those who have taken their first shot of the AstraZeneca vaccine and they're a bit hesitant to take the second shot. How is that being handled?
Well, there are public health campaigns that continue. I think we've not seen much of that problem, to be honest, in the UK. The advice is that for people 30 years or younger, it will be better if they were offered another vaccine if it's available. And I think that comes mainly from the balance of risk versus benefit, because we know that younger people are more likely to be asymptomatic and suffer less from the coronavirus disease itself. However, they are more likely to pass it on. So when you balance the risk of the clot, which if I could remind you, is we're talking about a handful of people out of every million,
right?
Every million people vaccinated. So to be honest, the risk is insignificant.
Right.
But they're acting more out of caution to advise that people about 30 years or younger should receive any other vaccine if available. So we don't really have that problem in the UK, thankfully.
Well, Dr. Lale, we'll have to thank you so much for taking time out of your schedule to speak to us. So let's let you go so you can head back to caring for your patients.
You're welcome.
Well, the European Commission says it has launched legal action against AstraZeneca for not respecting its contract for the supply of COVID-19 vaccines and for not having a reliable plan to ensure timely deliveries. Under the contract, the company had committed to making its best reasonable efforts to deliver 180 million vaccine doses to the EU, that's in the second quarter of this year, for a total of 300 million in the period from December to June. But the company said in a statement on March the 12th that it will aim to deliver only 1/3 of that. A week after, the EU Commission sent a legal letter to the company in the first step of a formal procedure to resolve disputes.
Indeed, the Commission has started last Friday a legal action against the company AstraZeneca on the basis of breaches of the advance purchase agreement. The reason indeed being that the terms of the contract or some terms of the contract have not been respected and the company has not been in a position to come up with a reliable strategy to ensure the timely delivery of doses. What matters to us in this case is that we want to make sure that there is a sufficient number of doses that the European citizens are entitled to and which have been promised on the basis of the contract. So the Commission has indeed started this legal action on its own behalf and on behalf of the 27 member states that are fully aligned in their support for this procedure. Thank you.
Thank you very much. That's the show for tonight, but don't forget to protect yourself, continue to take responsibility, and of course, visit our website, channelstv.com, for more updates and better understanding of the pandemic, plus other stories just for you. Well, thank you for watching. I'm Kayode Kikulu.